The second development I wanted to share today is around antibody tests. These tell you if you have had the virus and have developed antibodies in response that might help you to fight the virus in future. COVID-19 is a new virus, and we're learning more about it every single day. I want to be frank with you about what we don't know as well as what we do know. We're not yet in a position to say that those who test positive in these antibody tests are immune from coronavirus. But as our understanding of the disease improves, the insight these antibody tests provide will be crucial. They can help us to understand how our bodies react to coronavirus and how it's spread across the country. We're backing efforts to develop our own homegrown antibody tests through our UK Rapid Test Consortium, and that work is showing some early promise. And as you know, we've been looking at a whole series of commercial antibody tests. Now, many of these early tests were not reliable enough for clinical use, but we have made some available at small scale. And we now have the results of our antibody surveillance study. This has told us that around 17% of people in London and around 5% or higher in the rest of the country have tested positive for coronavirus antibodies. This was based on a sample, but for the public at large to know whether or not they've had coronavirus, we need antibody tests at larger scale. 2 lab-based products produced by Roche Diagnostics and Abbott Labs have been given a positive evaluation by PHE and approved by the MHRA, and 3 further tests are being assessed right now. And I can announce today that we have signed contracts to supply in the coming months over 10 million tests from Roche and Abbott. From next week, we'll begin rolling these out in a phased way. At first to health and care staff, patients and residents. The UK government has arranged supplies of these tests on behalf of the devolved administrations, and each devolved nation is deciding how to use its test allocation and how testing will be prioritised and managed locally.